On today's episode of the AMP'D UP211 podcast, James Calcagni. James is the founder of Liquid Limbs, a team of engineers and industry experts committed to developing and manufacturing innovative devices and mobility aids to improve accessibility, independence, comfort, and overall quality of life. His latest invention, the Navigator, is highly anticipated by the entire amputee community. It is our pleasure to introduce Mr. James Calcagni. James, it's great to see you today. Thank you so much for coming in and being on the show. I know we've been trying to hook up, so to speak, in the podcast world. We've had a few attempts, and here you are today. How are you?
Hey, Rich, it's really good to be here. Excited to have this conversation with you and just get a chance to talk with you. And I've listened to several of the episodes, so it's very exciting to be actually a part of the show now.
Oh my gosh, that's so nice. Brian, someone's actually listening to the episodes. This is phenomenal. We have a fan. So yes, I appreciate that. And we are wanting to get your story and the story about your company, Liquid Limbs, out into the amputee community and do some great things together with this product that you've created, the Navigator. And I think so much of these types of interviews, because I've done this a few times now, you know, something that, let's say there's a backdrop that is sort of built around, you know, a product or a particular charity or effort to improve the lives of amputees. And I think where my fascination starts with people like yourself, James, is I want people to know a little bit about you. And certainly I know, being as entrepreneurial as you are as a person, you know, putting your heart and soul into this company, into this product, you're super, super anxious to talk about, you know, that and the objectives, you know, built around that. But I think an important connection point for people when they think about what you're going to be offering the community is, who is this guy? And I'll give you an example. So after I became an amputee, I wanted to go back to something that I loved in my younger years, which was cycling. You know, I rode my bike, you know, a lot when I had two legs. So wanting to go back to that was really important to me. And so many of the sort of comeback stories with amputees is built around adaptive devices, things that allow us to traverse certain bridges, certain pathways to reach our goals, which again is what the Navigator is all about. But for my particular scenario, I had discovered that what was probably going to be the safest thing for me to do as an amputee was to get involved with e-biking. So e-biking being that you have a throttle capacity with an e-bike. So the biggest fear as an amputee, especially when you're doing a solo ride, is what happens if my leg malfunctions? What happens if suddenly I lose the ability to pedal myself home? And that's a stress point, and certainly a fear that a lot of amputees have about doing active things on their own because they worry about an equipment failure. And certainly I can't crawl home like a baby all the way home. So e-biking made a lot of sense in that it created a safety net for me where I could just, if something were to happen, if my prosthesis suddenly fails on me, it's not as if I can't balance anymore. It's just now I have to throttle all the way home because I've lost the ability to pedal the bike. So that was a big thing for me. But getting back to my original point was I really wanted to get into the history of who was creating the bikes, what their stories were. And I discovered a company based out of California called Saunders, which a guy named Storm Saunders, and that's actually his name, Storm. Pretty cool. I wish my name was Storm.
That is a cool name.
That would be awesome. Although Storm Bontkowski, I don't know, that doesn't really have a ring to it. So I had sort of gotten into his story, which was he was a California kind of surfer type that had gone through an injury and he was wanting to get active again. And he found that e-bikes were a great way to get active again and to be able to acclimate to doing something very active that didn't necessarily risk an injury for him again, and allowed him to sort of ramp up his progress slowly. But he, of course, discovered that e-bikes were very expensive, so he wanted to create an e-bike that was affordable. He did a Kickstarter campaign. You know, he was kind of this really, really cool kind of story as far as the individual, which obviously led to this enormous company now that has a full line of all kinds of different e-bikes, and you know, they do huge business all over the globe. So getting back to that is, when I think about you, James, I want to know a little bit more about you and know what your life path was like and what led you to doing what you do now, which is creating this device for people with limb loss, limb difference, maybe even a temporary disability, let's call it. Because someone could use the Navigator if they weren't an amputee, if they were just trying to not bear weight on a particular part of their body. So what were you like as a kid? How would you describe yourself?
Yeah, wow. Thank you, Rich, for that story. And it really helps shed light, like your personal experience, looking for that bike, because something for me, it's been super important. I'm not an amputee. And so empathizing with the community and really understanding their problems and what they're looking for has been super important. And so I'm glad you kind of actually are bringing this up, because it has been something that I think for me has been super unique of mine, is my ability to really empathize with the community. And so you asked, growing up as a kid, actually, when I was 8 years old, I was diagnosed with Lyme disease. And so as a kid, I actually was really sick. So I was in a lot of doctor's offices. More often than in school, I was actually going to doctor's offices growing up. So starting at 8 years old until I was 19 years old, that was my experience. I had a lot of really severe pain, and really significant fatigue, and so this was kind of my outlook was with through this lens. And so when I went for college, for university, I actually decided to go for biomedical engineering, to hopefully engineer a cure for Lyme disease, was my original plan. Um, and really focused on just like finding a solution for myself, that would just allow me to live a like better life. And so that's kind of the story of how I got involved with biomedical engineering. It goes a little bit farther, actually. When I was so I went to Penn State University. When I was there, I got another tick bite, and it crashed my whole system. I spent a couple weeks in the hospital, able to, um, you know, move, and I'm unable to get out of bed, and just in a ton of really extreme pain. At this time, I was taking over 40 medications every single day, like all these different pills. And so 40 pills every day, like 7 different antibiotics, a lot of different heavy duty medications, Seroquel, lithium, like these really serious drugs, they were giving me. And so out of that, I finally found someone that was able to help me, luckily, and I was able to get better. I was able to get off all the medications, but it kind of shifted my mindset, actually, towards like, um, living, actually, just in general. And so that's when I went forward with school. I went into mechanical engineering. I wanted to make more solutions for different problems, and I got involved with robotics and these exoskeleton devices that help you walk better. And we were using them for rehabilitation for people with MS. And so got really passionate about that I could like use my engineering skills to help people live their lives better. And I was really able to empathize, coming back to that point, with people that have MS and people that have disabilities, while I'm making these devices, because I had experienced, while it's not exactly the same, like my own kind of disability growing up, and I knew what a lot of the similar pain points were, and those missing out on those opportunities. And so that just naturally led me to find prosthetics, and it's been something that I've become so passionate about. As I engage with people in the community that share their stories with me, I often find I have a lot of synergies with the amputee community. So even though I'm not an amputee, I've been able to find that I really understand a lot of the things that they tell me, and when I don't, I'm always there to ask questions and learn more, and kind of get the better picture, because I'm not creating this device or like these products for myself. It's for other people. So I want to really make sure I understand um their situation, and their kind of perspective on the products, and also on just on making sure the solution makes sense for them.
So you're,
It's been
yeah, I
growing
don't mean to break
that.
your momentum. You're very much not a stranger to chronic disease.
Mm,
You had, a life experience that was based in a very, very rigorous and strugglesome medical journey. You sounds like at a very young age, you were spending a lot of time in hospitals. You were spending a lot of time in, let's call it, a series of diagnosis, and also different types of treatment plans to try to get your arms around what was bringing you pain and fatigue. And yes, I do think that type of life experience can really set the stage for who you are as a person. And
mhm,
I've met plenty of people who have never, I mean, literally, aside from, let's say, the common cold, have never experienced a medical event really in their life. And the first thing I will say is good for you. That's wonderful. However, when the time comes, and it comes for everyone, we all experience some sort of medical event at some point in our lives. It's just because we're fragile creatures. It's going to be rough, because if you're not used to that, if you've never experienced that, there's this thing that goes on with your body. And I know I have felt this at different points in my own lifetime. You feel as if your body has betrayed you. You feel as if your body is sort of like working against you, where you have all these hopes and dreams, you have all these things that you want to do, and your body is essentially blocking you from doing those things, to experience life on a level that you feel you're capable of, but it just continues to hold you back. And your work in the engineering fields, your education, and
mhm.
then the subsequent sort of vision of creating this device obviously makes a lot more sense now, because here's a young kid who came from a chronic condition, really experienced firsthand what something that is holding you back in a permanent state feels like. And very often, amputees struggle with that because there's that sense of loss.
Mhm.
And then we learn how to accept what the cards that we've been dealt, and then we get on with it. But what's very exciting about what you're doing with Liquid Limbs, and in particular the Navigator, which we're going to talk about, is you're giving amputees, people with limb differences, an opportunity to live a better life in order to do some of the things that may seem very, very laborious without this device. And when would you say, given all of that experience you had with the exoskeleton, because you're working with people that are disabled, let's say MS patients, people that need help in their daily movements, when did you sort of traverse that into like the amputee space? When was that sort of, when did your familiarity with amputees become a thing for you?
Right, right. No, it was not like the one thing, and then all of a sudden I was building prosthetic legs. It was kind of a build up, and I started with that research lab building these exoskeletons, and I was learning so much because I was like the only undergrad in the lab. It was a bunch of PhD students, and I was really learning kind of like what goes into designing one of these devices, and so learning this design process. I actually did an internship with a company called Medis Bionics. They had a relationship with the lab actually, and so I did a summer internship with Medis, and that really opened my eyes to this world more in particular. And so I did a project for that internship where I designed these these 3D printed finger prostheses for people with partial digit amputations. And so ultimately created a product actually for that was 3D printed so we can make these really low cost devices for people that didn't have the full mobility with their fingers. And so I think I had a turning point when I gave this device, which I had completely designed myself, this 3D printed finger. He was a nurse, and we made him one that was custom just for him. And like seeing his face light up when he was able to type, and use the finger to like turn a Rubik's cube and stuff like that, really like gave me this feeling that like I was giving something like back to someone that they didn't have before, and that they thought they had like lost, and that now all of a sudden they could do like typing was really important for him, and seeing that kind of over the summer when they would put the legs on patients, people would walk for the first time, like those feelings really really stuck out to me. Like I want to give this to people. I can make people's lives better. And so that was kind of the big thing. And then learning of the problem that a lot of these devices aren't waterproof, and that this is actually an issue. Um, that even they make these very expensive legs. People can't use them to do all the same things that we're necessarily able to do, like fully able bodied. That just made me realize this is a problem that needs to be addressed, and so that became my senior design project at Temple, and it's been my focus since then. It's been these devices specifically.
Yeah, and so that transition makes a lot more sense now, given that you were exposed to someone that was you were sort of had a front row seat, let's call it, to seeing what happens when someone that has experienced limb loss, whether that was hands, feet, whatever, suddenly was given the ability to, use their hands again, walk again, do something that maybe for most of their life they had taken for granted, but was sort of ripped away from them. And now
Mm.
they were doing it again for the first time. So that energy, sounds like that energy really, really gave you a high
Yeah.
spiritually, mentally, however you want to, phrase it. And then you thought, okay, very often these devices can't be used in certain situations. I had a prosthesis that I'm no longer in it, but I had a prosthesis that had a hydraulic ankle on it, and if there was anything I was told specifically over and over again is do not get this wet.
Mm.
Do not. Don't don't go through a puddle. I mean, I even had a technician tell me, try to avoid, areas with high humidity.
Oh my gosh. You can't go outside, right?
I thought,
Here's your $50,000 leg, but you can't go outside to
I'm
walk
like,
around.
what do you mean? I can't go outside when it's humid?
Oh my god.
And Chicago summers are can be pretty brutal in the humidity category. So
Wow.
I thought, okay, well, I guess I won't be going outside. So there are limitations with certain technology, and this adaptive device that you've created, this assistive device, the Navigator. When did that sort of enter your consciousness? When did that suddenly sort of become, your little brainchild?
Yeah. Yeah. So following that internship, we had to do a senior design project at Temple, and so this was actually the topic that was the focus of my project. And it wasn't just me. I had some team members on my project team. So three women engineers, all women on my team. They were like super brilliant too. So I had like the cream of the crop in my engineering class. Really bright women on my team, and so we just started to explore this problem of what it means when people are saying that most of these devices like aren't waterproof. And so actually to learn about this, because I think that there was a really big knowledge gap in the beginning about these devices and what people were looking for. And so actually my solution was I went on Instagram, and I looked up hashtag amputee, and I just started messaging all the people that I see that were like lower limb amputees on Instagram, and just messaging them and asking them questions. And I basically asked everyone if they'd be open to do an interview. And I just started talking to people in the amputee community. And so that is where once because I was starting the project, but I didn't know what we were going to do yet. But once I started asking this question to all these people in the amputee community, kind of like what do you do when you go to the pool? What do you do when you go to the beach? How do you live? Like what if you go in the rain and the puddles? Like, so I'd ask questions like this just because I had no idea. So I'd ask all these people the same kind of list of 30 questions, 20, 30 questions. And one of the people, was a young boy, and told me this story when he goes to a water park. In order to go down the slide at the water park, you can't wear your prosthetic leg. A lot of the times they don't let you because it's like a safety hazard. And so he would actually have to crawl up on his hands and knees on these like spiky metal steps
Mm,
just to go down the slide at the water park. And that really got to me. I think maybe because I remembered all the things that I wasn't able to do, I guess when I was that age, with the Lyme disease, and this like the fact that he like now has to like crawl up the stairs at and I was like, nope, that can't be the problem. Like I'm an engineer. Like I'm going to make a leg that allows, like if our legs can go down the slide, then it's just a problem with technology. Like the technology isn't there to match what our legs are doing. Able to go down the slide and able to walk up the slide. So we're going to make something. I'm an engineer. We're going to make something that solves the problem. That was basically my idea. And then I just kept interviewing people and realized the shower was a really, really important problem for everybody I was talking to. That just standing in the shower, trying to take a shower, this was the problem. And so we hyper focused on the shower, and making a device just for standing in the shower. And so that's kind of what led to focus on the Navigator, and then we've gone from there with the product. So
yeah.
we'll dive more into
So
it. But
if I could, describe it a bit, I've been fortunate enough to view a prototype and been allowed to use a prototype. Is just being transparent here. Is this is essentially, I guess, most amputees would probably look at this as, let's call it, kind of. I guess the way to describe it would be it's sort of a crutch, but not really a crutch. It's something that allows me to bear weight with my residual limb. It's not socket based. It's more of a cradle that your residual limb sits in, and there's a brief acclimation period that allows you to slowly work with it to the point where you can perform. For me anyway, it's been giving me the ability to perform pretty simple tasks, walking across the room, getting in and out of the shower, making a meal, going from, let's say, the couch to the bathroom, doing things that would normally require many amputees that are not in their prosthesis, which we all know donning a prosthesis can be a bit of a process for people. This is a quick sort of quick exchange type of situation. You're not putting on a gel liner. You're not donning a socket-based prosthesis. You're essentially just dropping, sort of setting your limb into this device, strapping it on very quickly, and away you go. Am I off the mark here, or is that?
I think you did a great job describing it. Yeah, it's like a mobility aid, right?
Yeah.
Like a specialty kind of cane that just helps you stand in the shower, do what you need to do in the bathroom, and the whole thing we designed really based on what people were telling us they wanted to do with it. So they wanted to be able to stand in the shower. They wanted to be able to wash their residual limb in the shower. So it's got this like open socket so you can wash and clean your limb and you don't have to,
Yep.
Take it off during the shower. So you can access your leg. It's compactable, so you can take all these things apart, put it with you in a bag if you want to go travel to like a hotel or something like this. You could bring it with you.
I want to make mention of that.
Came out of what the community was looking for.
Yeah, I want to highlight that. This is collapsible. It can be taken apart and easily put back together. Goes into a travel bag. There have been many, many times that I have been in a hotel, and we all have, as amputees, we all have our routines at home, the things that we get used to, that we're comfortable with, as far as the way we transition from our bed, let's say, to the bathroom, to going into an area, whether that be a shower or a bathtub, whatever we're doing, we're very used to that. And what can be sort of mind-blowing is when we travel. When we go to a hotel, we go to a room, let's say, that is not necessarily accessible. We don't have all the comforts that we're used to in our home environment. This is a perfect device that would allow you to be able to navigate an unfamiliar space like a hotel very easily. And you can just pack it in your bag. It's not something like a prosthesis that's necessarily very bulky for some. I know some people, there's quite a bit of gear, quite a bit of equipment. Not only can you get it wet, so now you're going in the shower with it, which with many prostheses you cannot get them wet. And it certainly cuts down in terms of timing. Let's say, for lack of a better phrase, you've got an urgency and you got to get to the bathroom. I mean, sometimes donning a prosthesis in that situation, you just don't have the time. You don't have the time. And, it's super helpful to have this. And we're going to definitely show plenty of images on this episode, at least the video portion, if you can check it out, of what the Navigator looks like and, what purposes it serves. And I know you've been doing some product testing at this point, James. You're employing people like myself in order to get some real-time feedback on what the Navigator does, what is good about it, the bad, the ugly, everything. You seem to be anxious to get feedback.
Yeah.
So explain to me how that process has been going. What kind of commentary, what adjustments have you made? What has that experience been like for you?
Yeah, I'd love to talk more about this because this is really exciting what's going on right now. You were one of the first people to get this device
Cool.
in the amputee community. Just so glad I connected with you, and all these other people that are testing it right now. Actually, were some of the first people that I initially interviewed, on Instagram. I wanted this to be something that, obviously, it's something that's coming from the community, but I want the voices of the community also to continue helping me guide this as I make the product. Like I said, I'm not an amputee. I'm making this, for amputees. So it's very critical that amputees are testing it, giving their feedback. So we have had some really, really cool pieces of feedback that we're making some modifications. So you should be getting a version 2 sometime in the near future, hopefully, and see what you think about the changes and improvements. Some of those, one of them is like, seems kind of basic, but it's just the height of the handle. For some people, it was a little bit, the max height was still a little bit too short, so they needed to like kind of bend a little bit to use it, and it just wasn't comfortable at that height. So we're making it a little bit longer. We actually was before designed to the size of the 3D printer. So we got a bigger printer, and so we're making that change. Same thing with the handle with the grip, making it more accessible for people with different hand sizes. So some people that weren't able to kind of hold it the way it was situated, we're making those changes, and then we're testing it, making sure people like it, and then we'll do it again if they don't like the revised version. And then the straps, we're making material changes for the straps, make it a little bit more comfortable, and providing some more options for straps. So we want people to have different options to strap around the thigh, strap around parts of the leg, whatever is most comfortable for them, so they can kind of set it up in a way that works for them. And then we do have some small changes with the pins. So it'll be an easier pin system. So it'll be easier to slide the parts on and off and adjust the height. And it won't be like a separate device. It'll be like contained within the device. So it'll just be overall a better user experience and a more comfortable. And the big change that I'm making is it's all going to be dishwasher safe. So that's going to be kind of
that's awesome.
Claim to fame is everything. You're going to be able to throw it in the dishwasher and just clean it. Easy to dry and clean. Just every time you're done, you want to throw it in the dishwasher. That's our prosthetic leg. So
how many prostheses can you just throw in your dishwasher? I mean, that's pretty amazing, and so important that you are harvesting this data and you are hyper focusing on that feedback and making all of those adjustments so that we can have the best experience possible with it. And this may be speculation, but in a perfect world, let's call it, when do you think this groundbreaking product is going to be available?
Yeah, no, I'm with you. I want to make it available right now too.
Yeah.
This data has been it's been super critical. And these changes, I think are going to make a really big difference actually. And this is not just like a one-time thing. We've been iterating this whole time, since we started going back and forth with the amputee community, making sure we make the best product possible, for them. And so getting it out on the market has been a process a lot longer than I thought it would have been. I was hoping it'd be there by now for you guys, but so we're going to make this round of changes. I want to get more of these prototypes out and to the people, make sure that everyone really loves the product, and then we're going to be basically launching it on Kickstarter campaign, which has been kind of delayed until we really won or finalized, happy with the product. Like everything perfect, and we have the number of people that we think are necessary to launch on Kickstarter. So we do have it available on our website to pre-register now. If you want to be on like our list, they go through liquidlimbs.com and you can get like pre-registered to kind of get it when it comes, like when it's out. I'm hoping sometime in the next few months that we will be launching on Kickstarter.
Okay.
And I think with support from people like you and people in the community, spreading awareness like this, we're definitely gonna be able to launch successfully and have it go. And so that's not so much my concern. It's more more right now, actually getting a couple of legal situations tightened up and getting funding. We do need some funding to bring this to market. So that's been kind of my focus, and making sure we get this. But I feel, from the feedback I have received, very actually good about the product. So we're kind of changing little things, like you heard, like the shape and curve of this and the height of this, but ultimately we've got really great feedback, that people want this product and they want to use it and have it in their lives. So that's, very exciting for us, and I'm excited to get it out there as fast as possible. I don't want
Yeah,
I want
so you're in a product testing phase. It sounds like once you get your prototype, let's call it, 99% there,
yeah.
then you're moving into this funding phase, which is the Kickstarter idea. And
Mhm.
then once you can ramp up funds for production, I'm assuming production and marketing, I think, would be, the big steps there. Um, I would say, would we be talking by the beginning of next year? I mean, is that feasible?
Definitely, definitely. I'm really, my hope is we can, in the next month, get some more of these units, back up. My original number was 50. I wanted 50 people, 50 amputees to test the device. So whether or not we hit that number, we'll definitely make sure we have enough people using this thing to test and make sure we've had our satisfaction criteria met. And then, basically, like marketing, the funding right now is more the marketing side, so we can launch it on Kickstarter. And so, yeah, so definitely, like this year, like that, we're working on this. I'm working on it every day, making
Yeah.
this get out there. So, no, it's coming. It's definitely coming.
Do you do you feel
I think
like that's the
yeah.
biggest challenge, though? I mean, these are great ideas. People have great ideas. They're innovators. They're visionaries. But getting the sort of traction, let's
Yeah.
call it, and creating forward movement, obviously requires resources that we don't always anticipate, and it takes time.
Yeah.
Time is a critical piece, because it sounds like we've got something here that definitely there's a demand for.
Mhm.
It's getting very, very positive response. However, there are just challenges in that bringing it to market
Yeah.
kind of concept. And very often, things like Kickstarter, whether that be, any kind of private funding, if people want to reach out to James and his team and figure out ways to give this thing a little bit of rocket fuel, let's call it, to
Well, we
put,
could use some of that.
yeah, to push it along and get it to a much needed community that very
Right.
often struggles in silence. And one of the reasons, I'm not personally like a big, I'm not really like a big endorser of products necessarily. That's not really my thing.
Right.
I think for me, first of all, what fascinated me about you is obviously your age. You're a young guy. So I
Mhm.
see you sort of doing these very, very, you know, kind of impressive pursuits in this space, trying to create something for a community that I'm also very passionate about. But then having the opportunity to actually use a prototype and
Mhm.
to see how valuable this is for people like myself.
Yeah.
Very often people don't see the potential or the possibilities in life as an amputee because they just don't have the equipment to get them there. So if someone were to give me a walker, let's say, and said, "Well, this is now your way to get around. This is it.
Right.
Everywhere you go, everything you do, you're going to use a walker." And I mean, I'm sure I would, it would build my upper body strength, let's call it. But that closes off a huge amount of possibilities for me in terms of my life and my lifestyle and all the things that I want to do. And things like the Navigator, they're kind of like the gateway to getting to the next level, to realizing I can be more active, I can do more things, I can improve my mobility, right? Because so often amputees are transferring from a wheelchair onto a shower seat. And we all know that staying in a seated position as an amputee isn't necessarily the best thing for you. And getting up, getting mobile, getting upright, let's call it, is a huge health benefit for people like ourselves. And, I would encourage anyone that is moved by James, his story, the products that he's creating. And if you're interested, please, seek out James. It's liquidlimbs.com. They have a website, and soon to be having, a Kickstarter, which I'm sure you're going to be doing some posting about that as well.
Yeah.
And this is a very, very important thing. So we're asking the more fortunate of us, let's say, to consider helping this cause and bring it to market sooner than later, because we all know in these situations, these entrepreneurial situations, capital is a big part of the puzzle, and I was going to ask you, I know Liquid Limbs is a company, Navigator is a product. Where else do you see yourself going with this? I mean, Liquid Limbs as a company, what other ideas do you have? Are there other ideas? What do you think?
Yeah, I was just gonna say I am so passionate to get this one out there because I already have a design for above the knee amputees that I want to get out there next, and like it just makes sense, to do this one first. But like there's other communities that also need help and need products like this. So I've got a design that I want to push for the above the knee group as soon as this below the knee one's out on the market. And then once we have, these are the shower legs, right? The Navigators. And then I want to do a beach leg, like a pool leg that's more affordable. And I've got a bunch of ideas, things down the road, but I told you that water park story. Ultimately, like I want to have that water park leg, and also work with like kind of some of these bigger groups and just make more accessible, waterproof, dishwasher safe prostheses and products that are really kind of meeting this need that I've feel is really impacting a lot of people, and that should be like solved. It's just a technology problem for me as an engineer. Like I really see myself just working on making these devices. I'm obviously not like building cars or spaceships, but I feel like there's a big need here, and so I want to put more of my talents focused on this. So definitely the funding would be very helpful. We do need some serious capital, like just to make those molding machines for the Navigator. It's about $150,000 for the mold tools that we need. So that's what, like, hopefully we'll get there through Kickstarter. But honestly, like even just to run the Kickstarter successfully, we need dollars to make those 50 units that I mentioned, to do marketing, to get awareness, to do the Kickstarters. It's expensive, so we probably need to raise like 150K just to do the 150K Kickstarter, so we could get our tooling actually.
Just to get out of the starting gates can be very, very daunting.
Yeah,
the number of amputees is growing. This is a very, very real community. However, it's quite underserved, and someone like yourself, bringing your best self to this, wanting to promote the idea that people need to be mobile, they need to be moving, they need to be living out their lives in a way that they don't feel limits, I think is very, very inspiring and shows a lot about who you are as a founder and a visionary in this field. I anticipate there's going to be great things on the horizon for you and your team. And again, that's liquidlimbs.com. James, I want to thank you for being here today. It's been such a pleasure, since we had our first conversation on the phone. And I want to say, gosh, that was, I'm thinking that was like it was like over a year ago. It had to be. And
it was like a year. It was about a year, probably a little bit less than that.
Okay.
Like around
so I'm trying to remember if you reached out to me. I think you reached out to me. I want to say
I was on another podcast with James Dixon. What's his? I forget his last name. But I was on his podcast, and then he told me to talk to you. He said you were in the U.S. And then I just had you on my list of people. Obviously, we need a range of people to test our products out. So you were at the top of my list, and I'm just so glad I stayed in touch because just your words and kind of representation of the community has been really powerful for me to have that access and be able to kind of hear your thoughts on the product and the confidence you've had in it has been very, very motivating for me going forward because I use the product myself and I've walked around on it and I can't tell you how many laps I've done in my basement here walking on the product. Sure. But I'm not an amputee and I don't need to use it like when I I have showered with it, but I don't use it when I take a shower normally. So like hearing someone that actually gets benefit directly from the product has been so powerful to hear your words, and I'm so excited for you to keep trying these as we make the next ones, and getting the word out also because I think people like want to listen to you also and hear what you think about these type of things. So I'm glad that you are a part of this also. It's really important to me that there's like a voice there. So
yeah, no, I feel like you and I are engaging and are part of something much bigger than both of us,
right?
Which is what this is all about. And I so appreciate you giving me the pleasure of not only interacting with you, but also being part of sort of this discovery process that you're going through right now, the way all this is coming together and materializing. James, I want everyone to check out liquidlimbs.com and again,
and they can reach out. You can reach out to me directly. James Calcagni, or if you sent us Liquid Limbs on social media, James, you reach out to me. I'm happy to talk with you also. And thank you, Rich. Thank you so much. This has really been an incredible opportunity just to tell this story. And I think, like you said, this is a lot bigger than just me or anybody else. This is something that's going to change lives. Hopefully long after I'm gone, people will still be using the Navigator and still be
that's great.
Part of this mission.
What a great legacy to aspire to. I'm glad that I can be part of that energy. You are James Calcagni. I am Rick Bontkowski. This is the Amp'd UP211 podcast. I want to wish everyone health and happiness, and we'll see you next time. Thanks.